Now let's discuss about the laparoscopic anatomy of the inguinal canal. First, let's understand why the laparoscopic anatomy is different. This is because in case of laparoscopy, we see the things from inside out, but in case of open hernia repair, the things are seen from outside in. So when we think about the laparoscopic view, the key landmark to understand the laparoscopic anatomy is the iliopubic tract, which you can see here. This is the iliopubic tract. Now basically when we see the inguinal ligament, we say it extends from the anterior superior iliac spine to the pubic tubercle. But the same thing when we see from inside, there is a fibrous band which extends from ASIS to pubic tubercle, and that is the iliopubic tract. Now why this iliopubic tract is important? This is important because anything above this tract is the safe and anything below this tract is unsafe with respect to the TACK placement. Now first let's see this diagram and understand it. This here white color ring is the deep inguinal ring. From the deep inguinal ring you can see this is the vas deferens, this is the spermatic vessels, and this is the iliopubic tract. Now here we see the two triangles which are most important to understand for the laparoscopic anatomy. These are triangle of doom and triangle of pain. Now the triangle of doom is medial to the triangle of pain. Now first going to the triangle of doom. The boundaries of triangle of doom, medially it is formed by the vas deferens, whereas laterally it is formed by the spermatic vessels. The content of the triangle of doom are external iliac vein and external iliac artery. The TACK placement here is avoided. Why the TACK placement here it is avoided? Because if you place a TACK during laparoscopic hernia repair, it will cause catastrophic bleeding. Now going to the next triangle, that is the triangle of pain here. The triangle of pain basically it is lateral to the spermatic vessels and below the iliopubic tract. It contains nerves. The nerves here we can see it as femoral branch of sternotofemoral nerve, anterior femoral cutaneous nerve of thigh, and lateral femoral cutaneous nerve of thigh. TACK placement is avoided here because if you place any TACK here, that will cause chronic groin pain. So now you understand why below the iliopubic tract, the tract placement should be avoided, because either it will cause a catastrophic bleeding or it will cause the chronic groin pain. Now let's go to the next diagram. So in this diagram I'll explain you. It is from inside. This view we are seeing from inside the abdomen. We are seeing at the left groin. The red colored mark structure which you see here, it is the iliopubic tract. And as I have already explained you, anything above the iliopubic tract is said to be safe. Anything below the iliopubic tract is said to be unsafe with respect to the TACK placement. Now here in this figure, we can understand the different sides of all the hernias. Like you can see here, this is our deep inguinal ring. From the deep inguinal ring above, you can see these are the inferior epigastric vessels. Now medial to inferior epigastric vessels, you can see the site for the direct hernia. You call it as a Hasselbalch triangle. So the Hasselbalch triangle boundaries, we know it is formed by rectus abdominis. It is formed by the inferior epigastric vessels. So this is the site for Hasselbalch triangle where you see the direct hernia. Now lateral to inferior epigastric vessel, here we can see the site for the indirect hernia, and indirect hernia occurs through the deep inguinal ring. Now going to the below the iliopubic tract. Below the iliopubic tract, medial to femoral vein. So here we have the femoral vessels. So below the iliopubic tract, medial to the femoral vein, we have site for the femoral hernia. These three are shown here because whenever we place a mesh here, the dashed line represents the site for the mesh placement in laparoscopic hernia repair. So we cover all these three potential sites. So here we cover here the yellowish portion which you can see. These are the placement site placements of the tackers. That is over the Cooper's ligament, over the area of direct hernia, and over the area of indirect hernia. These tackers should not be placed below the iliopubic tract in this region, as I have explained you. Placing the tack in the triangle of doom will cause catastrophic bleeding, and placing the tackers in the triangle of pain will cause chronic groin pain. So after seeing this video, you will understand the laparoscopic anatomy of the inguinal canal, and a hell lot of question you can answer, like structure that is injured in triangle of doom, contents of triangle of pain, landmark that divides the safe from the unsafe zone, most dangerous vessels in TAPP. So all these questions you will easily answer. Thank you.